Welcome to the Passion for Patients podcast. I'm Tonya Winders, your host and the president and CEO of GAAPP, the Global Allergy and Airways Patient Platform. 130 patient advocacy organizations all across the world are trying to ensure that patients live better and breathe better, living with atopic airways and allergic diseases. Today, I'm excited to welcome a guest here in studio. We have Victor Gascon Morino, our Vice President of Awareness and Operations, and it's his first time to do a podcast, so welcome him to the podcast today.
Hi, Tonya. How is everyone?
Great. So good to see you. Glad you're here.
That's a pleasure for me.
I know you're excited because first time to the U.S.
Yes.
Right?
First time to try the good Southern food here and doing a podcast. A lot of first-time experience here.
It's a lot of fun. Yeah. I'm so excited to have you here and to host you in my hometown of Nashville, where we're recording the podcast. So as we get started, share with me a little bit about your background and how you actually became a passionate patient advocate.
So I was born in Barcelona, as you know, but I haven't lived there most of my life. Now I live in Austria, but I started my life as a grown-up person in Asia, actually, in China, in Malaysia, Singapore, and Hong Kong, where I actually started working with different NGOs. I have been blessed with being working for NGOs my whole life, working and getting paid. Tonya, you know, that sometimes doesn't go together, those two concepts. So
true.
I have been blessed to call NGO my professionship and my call. And it was in one of those life journeys, I think in China, where I actually started working with one Spanish organization that worked in respiratory health. And that's how I started my journey in specializing for NGO and health. And that's how I found a GAAPP, like 12 years after or something like that.
Yeah, and so tell about how you came to GAAPP. How long have you been with us and how have you evolved into this current role?
So this is my third year in GAAPP. I think 3.2, let's say. Before, I used to work in a national Latin America, Spain patient organization, more focused on digital health. And then I joined GAAPP at the beginning as one position. And I have been blessed to be able to grow into the Vice President of Operation and Awareness position now.
Yeah. And you've done such a great job over the last couple of years of growing into this role, of really expanding. I mean, when it was just the two of us, Victor, there were 40 organizations in GAAPP, and today there are over 130. I mean, when I really stop and think about that and think about your role of outreach and awareness and operations, it's just incredible what we've been able to do over these last few years.
Definitely. And I think nothing could have been possible without the support, or your support, obviously, but also the support of our board, who has always been there for us, and our members who are always engaging with us. When we were small and then we are big, there's still the engagement and the love and the day-to-day work is always the same with them.
It's about supporting our family. It's about you. And that's why I think this has been so much fun. It's because we've grown the family together. And, I love it when people reach out and they're like, hey, I heard about GAAPP from this person who's already a member of GAAPP. Like, that's the most rewarding aspect of the work, is seeing how the community has evolved. So we're going to talk about awareness.
Yes.
And I want you to kind of share with us, first off, like, why is awareness important?
Well, so let's talk about awareness in health, especially. So awareness is crucial for our patients and for caregivers because it empowers them with the knowledge, the tools, and the education that they need to address their healthcare needs. This is very important, first of all, because this is how we get that very desired early diagnosis. That's your first step, right? To know about that this disease exists, these are the symptoms, and this is how you can start taking care of it. So that's awareness is always the first step into that direction. That's where it's crucial. And the second reason where it's crucial, and I think you're going to hear about our 4 pillars in this podcast. So imagine a pyramid, an inverted pyramid. So awareness is that top part of the pyramid, which is when you reach to absolutely everyone, patients, caregivers, family members, society, policymakers, and then the pyramid gets like thinner with education. So many patients get awareness, less patients get educated, even less patients get to work in advocacy.
Yes.
And even less patients get to work in research.
Right.
So that's why awareness is so important, because the biggest is the top of the pyramid, the more people goes to the bottom.
It's so important about that reach in advocacy and in awareness specifically, right? When we're as patient advocates, the very first thing we have to do is engage and maximize that reach to start like waking up awareness. So how do we do that? How do we maximize reach into the community?
So first of all, what we have to do when we work nationally or regionally or globally, first you have to define your audience, Tonya. So you need to think about on your organization, right? What are your demographics? Who are those people? Where are the ages? But what countries or what regions they live in? Or other questions that may or may not be important, like their gender, their ethnicity. It can be important, it cannot be. It depends on the cause or the pathology they're working with. So I'm going to give you 9 very quick tips to maximize. 9 tips to maximize reach.
Let's go. I'm ready.
So first of all, what you need to see is check if there's any bigger organization or an umbrella organization that is already running a campaign for your cause. So then jump into that. Don't reinvent the wheel. Try to jam into something that already exists, because it will save you resources.
Don't reinvent the wheel.
Yes.
That is a great lesson. Don't reinvent the wheel, okay?
And it will save you resources and everything. So make sure to see what everyone else is doing. That's number 1. Number 2, you need to leverage your social media channels. I know small organizations, they have it difficult because they don't have a community manager. But I think it has been becoming easier now with technology to do that.
Yeah. And so let's pause there for a second, because social channels that GAAPP is currently on, what are we doing?
So at GAAPP, we're doing a lot because we are global. So we have to try to attack from every side. So we have a big Facebook channel, we have Instagram, we have Threads, we have TikTok, and X Twitter, X now.
Less on X probably lately, but still viable.
Yeah, it's still there. So, but we also work in other channels that they're exclusive for regions, and we're going to talk about that later. We use WeChat when we try to reach mainland China, like the People's Republic of China, or Viber for countries like Bangladesh. So you really need to be flexible, because it's a big war.
Know your audience, know where they are, and go where they are. That sounds like the next tip. All right, great. Keep going with your tips.
So number 3. So first, you need to collaborate with another organizations. We have already mentioned see what the umbrella organizations are doing, but also check with influencers and all the stakeholders, healthcare professionals. You involve everyone in your awareness campaign, right? Make it like a really multi-stakeholder, because that's how you reach the people at their homes. If you involve everyone in the picture, you can host webinars and Q&As. That is very important when you're a small organization, because people, they want to hear from you. It's okay to have messages that are coming from big organizations, but at the end of the day, the patients that are part of a community of a national or regional organizations, they want to hear your voice.
Yeah. You're the trusted person in your community, in your country. Yes. And they do want that local perspective.
Yeah, and Q&As, Tonya, they are so important sometimes, because this is for countries where access to healthcare is difficult. Q&As can be the difference of a patient who cannot access to a healthcare center. They will not get diagnosed or prescribed or anything like that, but they might get that first knowledge that they cannot have it otherwise, because they live 5 hours away from the closest medical center, right? That happens in many continents. So now we are at number 5.
Okay. Tip 5.
Tip 5. Create content that is shareable. Not only for patients, but also for family members, for caregivers, something that everyone can share, everyone that is involved in your care team, not only professional care team, but also your family care team.
Think about that care team holistically, not just your healthcare provider, but your family, your friends, your social network, and how they might share the content as well.
Yeah, ask grandpa to share the content as well. So that's how you reach the community, which is what we want, right?
Yep.
And that goes to our tip number 6: engage with local communities. So if you have an organization that is local or national, go to those communities where the people make community. Sometimes it's like a club, sometimes it's a church, sometimes it's a civic center. It varies, right? Depends on from country to country. Those places are different. But go to those places. The city hall, sometimes they have opportunities for you to showcase these kind of initiatives. You just go to those places and see. So meet the people where the people is, right? Markets, I don't know.
I like that. That's our summary for that one. Meet the people where they are, right?
Yes.
Okay. Next tip.
So number 7, utilize email marketing.
Okay.
It's always good, but you utilize it wisely. So first of all, make sure everyone that is in your list has agreed to be in your list.
That we've always done this well, Victor. So that's why they're laughing and chuckling a little bit. So email, is so overwhelming, right? We get hundreds and hundreds of emails a day. So using email wisely and in a tailored, personalized way is what I hear you saying.
Yeah. You have to be concise. You have to be, you don't have to send many emails every month, just send that 1 or the 2 emails that they're very crucial, and make sure that everyone who is receiving it has agreed, and what you said is relevant to them, because otherwise as you say, we receive so many emails from the bank, from the supermarket, from our travel website. So sometimes we are overwhelmed. So when you email is very good, it's a very good tool for the patients to engage, to do that one click that will bring to some action, but make sure that everyone that is there has agreed to be there, and if they want to leave it, make it easier for them, and so we will also be good in those pesky GDPR and HIPAA concerns. Number 8, this is very important. You always have to include a call to action in your communications. So make it into a conversation, into an actionable item. You send some message or some awareness content to someone, but you need to create an action after that. But it has to be simple.
Yeah.
It has to be simple.
Make them answer the question, what's next?
Yeah.
What do I do now?
Yeah, like give us your information, or take this survey, or go to the doctor, or reshare this with your policymakers, or sign these letters. It has to be something. Always have to be some feedback.
Something tangible.
And some tangible, yeah.
Okay, great. I like it.
And the last one, I think, is going to be your favorite, Tonya. You need to be creative, and you think out of the box. Yes. There is so much communications happen from everywhere. Again, even from the bank, the supermarket, right?
Yeah.
So
how do you break through the noise and be creative? That's the key. Because to be honest, half the time I get through the first sentence or 2 and I'm like, I'm not interested, and I move on. And so I think that's a lot of people, right? We just get so much information today. So it's breaking through the noise, being creative, and communicating in a way that is meaningful for the audience, that person.
Yeah, definitely. Think outside of the box. And, nothing is predefined. Nothing is written in the awareness 10 commandments. So just make it fun, make it personal, make it fun, and
yeah, I think that should be number 10. Make it fun.
Make it fun. Number 10.
We definitely need to.
We're 10 now.
All right. Great. Well, Victor, thank you for those tips, because I do think that, we do a lot of awareness campaigns at GAAPP, and our members wonder probably, why do we do these, and what are the results? Are there short-term and long-term ways to assess, am I doing this right?
So that's the part that is complicated, because awareness is not something that is going to produce immediate results, right? That's, as we say, that's the beginning of the journey of the empowered patient. So you cannot look, you will have those immediate feedback or call to action from your message, right? That action that you're asking the people to do. But the real effect, what you want to accomplish with awareness, which is equip the patient with the knowledge and education that they need to start taking care of their health or their condition, that is a long-term goal, and that's a grind, and you need to repeat. It's not going to happen in one campaign, Tonya. We will have to do it like 11 times.
Yeah. I heard a statistic one time that I've never forgotten. It's that we have to, on average, we have to hear the same message 7 times before it even begins to become a new behavior or new thought process for us. So 7 times, you got to say the same thing 7 times before we start believing it and acting on it.
Exactly. So it's a slow grinding process, but it's always worth it. And we always have to think about this in the 6 months to 1 year term, if that's when it's going to be a tangible result. So
stick with it.
Yeah.
Be consistent in your approach. Evaluate how your reach and impact and engagement, your open rates, your click-through rates, all those different things are progressing. But you don't have to be freaking out week by week or month by month over those numbers. Yeah. It really is about the long game and how you see your community growing and engaging more consistently, right?
Exactly.
Okay. So turning that focus to our specific awareness days, right? Because again, GAAPP has GAAPP-sponsored awareness days, and then we've got a lot of awareness days that we just amplify and promote. So how do our member organizations, how do PAGs really maximize those awareness days?
So now I'm going to give you 4 tips, Tonya. Again,
I love your formulas, your simple formulas. These are helping us.
So, and we have talked about this in the previous section. So first of all, you need to analyze your demographic and your public. That is very essential for awareness days. Again, if we don't know who are we speaking to, we don't know how to speak to them. So
yes.
But it's very important, and it's something that we can do with online tools or just checking our Facebook demographics. So it's really easy, or talking to your community. So first of all, get them to know who are you talking to.
Not only talking to them, but listening to them.
Yeah, and listen.
Right?
Exactly.
I always say God gave us 2 ears, 1 mouth. So we should listen at least twice as much as we speak. I'm not always good at that, but that's what I try to remind myself. So know your audience, tailor your approach to that audience.
Yeah. So number 2, we have also talked about this: jump into an existing campaign with an umbrella organization if it exists, right? So join a big movement, because when we all, like for example, World Asthma Day, right? It's better to have like many people clamoring the same message, right? Like a demonstration. Imagine just a demonstration in front of the Capitol. So
yes.
It's better to have many people shouting the same message than having the same amount of people, each of them shouting similar message but with different words. So mainstreaming that message is important, and that's something, to be honest, that we still have to work. All our big organizations like GAAPP, we still have to do a lot of work to make sure that we are always in line with everyone, and we try.
Messages, I think, is really difficult when you're talking about 130 plus patient organizations in 80 different countries, right? How do we have really sharp, consistent, clear messages? But it is so important, because otherwise it just creates noise. It just becomes a lot of mixed messages and confusion and noise, and people don't know what to do with that.
Yeah, and think about some patients may be following GAAPP, and then they also may be following the national, Canadian asthma, and so they may be following few organizations, right? Because patients, they go to all the sources they can, right, to get that valuable education. So if they hear different message from different people, it just adds confusion. So it's not about doing exactly the same, but having like the same theme, right, or the same message every year.
Yes.
I think that's very important. And that goes to number 3. So use your own channel. Sometimes we use content, and it's great. We use content from umbrella organizations like GAAPP, but you need to adapt it to your own channels. And then we will talk about how we do that very soon in the next section. But also put your logo there as well, right? Yeah. Put your voice there, put your own message, your own thoughts. Don't just copy paste, right? Like make it personal. You can, and no one is going to oppose to that. Like you can use some asset that has been created for you, but you should personalize it as much as, right? Put your own editorial style and just speak the way you speak to your audience all the time, and that's how you will make it
be authentic.
Be authentic.
I think that's the key, because otherwise sometimes our community is like, wait, this doesn't sound like Tonya.
Yeah.
This doesn't sound like Victor. This isn't the way they would normally communicate or talk, and that loses trust.
Yeah.
So
yeah, it looks like something like that you just buy in the supermarket and you just open them, right? So yeah, make it your own, make it personal, and again, personal is always better. So the last tip I'm going to give you, Tonya, is, and this is very important, we have to create a safe space for discussion and debate, right? And with those campaigns, we need to respect other people's voices. People is going to come in, right? So it's good to have that conversation. You don't have to agree with everyone, right? So we have to create those spaces where the people can discuss, can share different views, but they have to be safe, obviously, right? They have to be monitored and make sure that everyone is comfortable in that discussion. But one very important thing, and I think that mistake I have seen it to do with many organizations, you should never refuse a call to help. Mm-hmm. Sometimes patients use your campaign to inquire about how to get to a medical service or how do I get this treatment. And that's not the right place to do it, but that's the only channel they have seen you, right? So they have used that little window opening to make that call for help. So don't refuse them. Just point them to the right direction. Point them to an email or to the address of a specialist, yes, or to somebody your website that they can see all those resources. So, but never refuse them. Just let them.
I think this is really important because it is a marathon. It's a journey, right? And so helping people progress from where they are today to the next step, to the next step, to the next step, and looking at it in that way rather than, okay, I have to, eat the elephant in one bite, doing it bit by bit, moving someone along. When I engage someone for the first time or someone reaches out, they want information about the work we're doing, all I want to do is get them to the very next step, right? Of wherever they are today, what is the next step to a more empowered, more informed, more activated person in their healthcare journey. So I think that is great advice for sure. So next up, let's think about a question that we do get sometimes from our member organizations, which is, I focus on eczema, but there are 20 other days. Should I engage in those 20 other days?
So short answer is yes. And long answer is yes, because so we have seen that, especially in the respiratory space, right? Or in the dermatologic and respiratory space.
Yeah.
Sometimes, so if we focus on asthma, for example, but we have discovered the underlying inflammatory connection between asthma and eczema and urticaria and
now the list goes on,
COPD,
and
you're right, some kind of COPD.
It's growing.
So I think if the disease that you're working on, or the condition that you're working on, I'm 100% sure it will have overlap, it will have connection, it will have comorbidity with others. So just welcome for you to share assets from other conditions that have relationship with yours, just because you never know when research is going to advance to the point that we will see that there is a clear connection there. Yeah. And most importantly, Tonya, sometimes we have patients in our communities, like we have a COPD community, right? We have patients that they don't have COPD. They think they have it. They are not diagnosed. They just came to organizations because they saw, like, we are talking about familiar symptoms, right? Or like something that is similar to what they have. But those patients, they may not have COPD. There is many, right. For example, to put a practical example, there is so many alpha-1 and patients in the COPD community, right? So it's also important for you to talk about related conditions, because you may have people.
You never know when someone's undiagnosed, misdiagnosed, or simply may have someone in their family or their circle of influence that could benefit from that information. Right?
So the answer is yes. If they are connected, just I think it's
yes. And for our member organizations, it actually brings money into your organization's door. So every time you engage in those awareness campaigns, You get a little extra for the kitty of your funding. And that's never a bad thing either, to get more resources to do your core work. And that's why we set up those communication grants.
Exactly, Tonya. And sometimes it is very important, even if there are small amounts, for some organizations, that is going to make the difference between, can I have a social media part-time or intern or something? Yes. That's going to make a real difference for many organizations around the world. So I think that's a great opportunity that GAAPP and other organizations do for the patient. Yeah. And we hope we keep doing it with more and more.
Absolutely. So one of the other concerns that I've heard from members, maybe not our listeners today, but others, maybe our listeners today, is how do I make these campaigns our own? Like you said, you should certainly do that, but how?
So first of all, with the importance of making your own lives, for example, let's talk about social media, right? Social media is not the same all across the world, right? We tend to think that social media is Facebook, is X, is Instagram, but that's the one we are familiar in the West. But we know there is so many countries where those social media platforms,
don't even exist.
They don't exist because they may be banned or they just not in use, right? Like WhatsApp is very used in the West or more in Europe, but it's less used in other places. Other places use Viber. China has its own set of social media. The same goes for Russia, right? And other countries. So it is very important when you get those awareness campaigns, those assets from other organizations, to be able to customize them. You need to be able to not only translate it to your languages or your set of languages, because some countries have more than languages or have regional languages, but also be able to translate that into your own social media channel. So I'm going to get that and I'm going to adapt it for WeChat or for Xiaohongshu or whatever, those. Yeah. So it's very important to, first of all, for us to know that other countries exist and they play by another boom. How do you call that? Another set of rules. Sorry.
Yes. And doing great.
And so that's very important. The language, the channel, it has to be customizable all the time. So it is when we create, that's why in GAAPP, when we create social media awareness campaign, we always offer the editable file so you can actually adjust it to your own community, or sometimes even in English, right? You need to adapt it to the way that your community speaks English, right? If you tell it like a small, I don't know, you can be like the Nashville Association of Asthma, and then you want to talk to them like the people talk to themselves. So,
you just said that you were surprised that there isn't a strong Southern accent here. Most people would probably disagree, but it maybe not as pronounced as what you expected coming in. Well, Victor, as we're wrapping up our time together, what's kind of your final word to our members out there that are tuning in to the Passion for Patients podcast today?
So the last thing I want to tell everyone and for you to drill that message in your brain, you don't have to do it alone. Yeah. Do not do it alone. Come with us, come to someone else, join with other organizations. Just don't do it alone, because it will be very daunting. It will be long. You will need resources that maybe you don't have. So come to us. We are glad to help all the time. And the message the message that has been prevailing for all these podcasts, make it personal. Yeah. Put your own spice, not that we are in the South.
Yes, add your own little bit of spice. Well, thank you so much for being here today, for sharing your expertise and your passion for awareness and for the great work you're doing at GAAPP. We really appreciate everything you're doing.
Thank you, Tonya.
So as we close this episode, I just want to remind you to tune in next time, where we're going to be hearing from Kristen Willard, our Vice President of Education, and learning more about that pillar. So definitely mark it on your calendar. 2 weeks out from today, you'll get that next podcast and hearing from Kristen. But in the interim, don't forget to visit GAAPP.org to learn more about our awareness days, our awareness campaigns, and how you can get involved. You can always reach out directly to Victor or to Spella, and we'll be happy to help you to learn how to really adapt and customize, tailor these awareness programs for you. Finally, share this podcast, tell your friends, tell other people within your organization about the podcast. Make sure that they subscribe and tune in on their favorite podcast channel. And until we meet again, stay passionate.